Immunotherapy is exploiting the capacity of the immune system to treat a disease.
The immune system is, of course, our major defense against pathogens, bacteria, viruses, also our defense against cancer.
But the immune system is not efficient enough usually in order to fight against them and remove them. And this is why it needs help.
We know about the immune system, even about becoming immune, like vaccine, for thousands of years. The Greeks found out that if one is exposed to a disease, then it becomes protected during second exposure. But then nothing was done about it for thousands of years. And then came the vaccination, which was the first immune manipulation that provides protection.
Jenner was a country doctor, and he noticed that cowgirls had beautiful face because they suffered less from smallpox than others. And he connected the cowpox and their exposure to cowpox to their being protected against smallpox.
Edward Jenner did inject a dead cowpox virus to a kid, and because the antigen was very similar between the cowpox and the smallpox, it made the child resistant to now smallpox.
Vaccination was one of the most important discoveries in the field of immunology. Vaccination saved lives of millions, billions.
The contribution of vaccines to public health, this is the most important and cost-effective until today for all diseases.
You may not know this, but vaccine comes from the word vaxi, which is in Latin means cow.
And vaccinia virus is the virus of the cowpox. Multiple sclerosis is one of the autoimmune diseases.
If you have an electric wire and the insulation of the electric wire gets destroyed, you get an electric short circuit. And this is what happens in multiple sclerosis. You destroy the myelin sheath, you destroy the insulation of the nerve, and you get literally an electric short circuit.
Although the immune system does not affect the nerve itself, but only the myelin sheath of the nerve, eventually there is a neurological damage that accumulates. There was no treatment for MS at the time.
The idea behind Copaxone was not to cure multiple sclerosis. They actually wanted to induce an immune response that will destroy this insulation in the nerves.
And we worked for a whole year and did not induce any disease whatsoever.
And not only it didn't work, it prevented multiple sclerosis in animal models.
And we did one experiment, and as they say, lo and behold.
By injecting this Copaxone, which is actually part of the myelin, you swap the immune response towards a more protective one. And they were smart enough to build on this observation.
And I think that didn't only open the way for MS, but for other autoimmune diseases as well.
I can be very proud that there are close to 1 million sick people every day feeling a little bit better because of my invention.
The problem with cancer is that the cancer is yourself. Is a cell of yourself or tissue of yourself that is not recognized as foreign.
What Zelig did at the time was to take an antibody, which is specific for a specific molecule on a tumor, and put it on an immune cell. And by this way, he used the immune cells, he targeted the immune cells to the tumor.
Once the immune system understands now this is a foreign cell, it can attack it and destroy it, and the tumor cannot hide no matter how it modifies and changes, it still carries these mutations that the body can recognize.
Now, at the time, I'm sure many scientists were very skeptical about this idea.
It was a revolutionary idea, and like most revolutionary ideas, it takes some time until they catch.
It kind of sounds too simple, maybe. That's why it was not accepted, and maybe some people even laughed at it. It was brought to clinical trials, and according to last research, with 95% efficiency, it doesn't treat, it cures B-cell lymphoma.
When I heard that it really can cure patients, I was happy, the happiest man in the world. However, I knew it should work because we did preliminary studies or research in animal models, and we knew it is working.
I think that the impact of this recent immunotherapy is much more important. It's at least as important as vaccine if it succeeds in getting rid of cancer.
The inspiration of Michael Sela still lives on within this department, and people know and are expected to do the unexpected, to do unbelievable things, and that you wake up with this desire in the morning, you feed it to your students.
So our small beginning that took so long time to accomplish has a future for the patients, and that's what we do.